Welcome to Medicap's Various Express. In today's class, we'll be discussing one clinical case. So before starting, let me tell you that if you have not subscribed to our YouTube channel, please do subscribe and press the bell icon so that whenever we update any new video or any new question discussion, you'll automatically get notified. Now let's see this question. So a 17-year-old female patient reported to the department with the complaint of pus discharge from the upper front tooth region since 2 months. What will be the provisional diagnosis? So they are talking about this. Also, you can notice this tooth. Okay, so this is Elise class 2 or probably Elise class 3 if pulp is involved, right? And this is the sinus tract. And they're asking the provisional diagnosis and they are giving history of 2 months. So what it could be? A sinus is formed. Let's see this. So just don't look the heading. You can just see what is this. And this is the, you can say, restoti. So basically this is radicular cyst. In the previous image also, in this image also you can see that this is the fractured tooth and this is the sinus. So possibility is there that there could be any cyst which got secondary inflamed and then the sinus formation is there. So the answer is radicular cyst, and this is also known as periapical cyst or apical periodontal cyst or dental cyst. Now let's see the proper definition of this radicular cyst. So this is a inflammatory jaw cyst originating from the epithelial remnants of the periodontal ligament. That's why it is also known as apical periodontal cyst, as a result of inflammation that is generally a consequence of pulp necrosis. Now this pulp necrosis, either it could be due to any trauma, but generally it is due to caries. Also there is male predilection, usually more, it generally occurs in males as compared to females, but that doesn't mean that females will not have. Even in question itself you can see that the question also it is relating to female. Now this is the radicular cyst. So initially whenever any tooth is there, and if suppose, let's say suppose there is some caries and it involves the pulp, then firstly there will be abscess, right? If it will be untreated, it will eventually lead to granuloma. And if granuloma persists for a longer period of time, it will eventually form the cyst. The basic difference between the granuloma and the cyst is of size. Now we are coming to that thing only, the radiographic features of radicular cyst. So the periphery is usually well defined or corticated. You can see here the white rib, right? The resorption pattern may have a curved outline in cases of radicular cyst. Majority of the cysts will be less than 1.5 centimeter, which is generally greater than granuloma. So on the other hand, you can say that granuloma is generally less than more than 0.5 and less than 1.5 centimeter. But cyst is always larger than granuloma. Now the cyst will be round to ovoid radiolucency. See here, right? So this is the radicular cyst. So whenever you have any long-standing cases of caries, or you can say trauma, like in this question you can see that Elise class 2 or probably class 3 fracture is there. In such cases it eventually lead to radicular cyst, right? So the treatment is complete enucleation along with the endodontic procedures. So this was all about the class. Also you can join us in WhatsApp and you can just press this link and you can just join us on WhatsApp, www.medicoapps.org/groups. So you can just press this link and you can join us on WhatsApp. Hope you have liked the class. Thank you.